You're back in regular session. It is 9. Okay.
Okay, no.
Back in regular session, it is 9:24. Okay.
All right, well, let's do this. I guess we kind of know the history, we know what's going on here. Let's just open it up to questions, and to hopefully come up with answers that are factual and move this thing forward. So, I mean, we know what we're here for, so what are the questions that the folks in the audience have?
And I'd like to ask, if you will, please state your name. The audio will pick you up visually. The recording won't pick you up unless you come closer up. You don't have to. It'll pick up your voices, but for the purposes of identification in the index, please make sure you state your name as you speak, please.
Counselor, Mr. Henry.
Thank you. I'm Dean Henry, and I represented the Old Fort Volunteer Fire Department, still do. And I don't have a question, Mr. Kirshner. I just have a thank you. I want to thank the Pleasant Township trustees, Ken Majors, for, in record time, in my opinion, getting together and getting the medical protocols back, for the EMR protocols back for Old Fort Volunteer Fire Department. As you know, we had a meeting on Wednesday. I think we all learned something on Wednesday that we didn't know, quite honestly. I think there was somewhat of a failure of communication. I always use the quote from the Cool Hand Luke movie. Remember when the warden says, "I think what we have here is a failure to communicate"? I think that's exactly what happened. And that led to, unfortunately, a spiraling, a domino effect of a lot of assumptions being made. And of course, we all know what happens when assumptions get made. From my client's perspective, they received a letter, because you were interested in the timeline. I'll just tell you, they received a letter on Friday via, I think it was via email, that went to the chief. The chief called me on Memorial Day, and I remember that day well, because then he sent me the letter. And then we met with the trustees. I did a little bit of work on Tuesday to try to find out what was going on. I spoke with Ken Majors, who was generous with his time. I spoke with my clients, spoke with a few other people in the county who sort of had a historical perspective on the EMS agreements and the protocols for the fire department and the medical director relationship between the fire departments and the medical director, which a lot of people didn't even know existed. There were a lot of folks that didn't even know there was a sort of an informal relationship between the Seneca County EMS medical director and the fire departments, which I think was also part of the problem here. But we met with the trustees on Wednesday. I brought copies of the letter with me. I wasn't sure exactly when I left the meeting, but I'm fairly convinced now they had not seen that letter before. And I just hate that when I show up for a meeting and somebody hands me a piece of paper for the first time and then asks me to talk intelligently about it. So they were kind of caught a little flat-footed. As were my folks. But at the end of the day, and my understanding is it was less than 12 hours later, they were back on. And that's, I want to thank the people, whoever was responsible for that, including Dr. Fitzpatrick, because apparently he had to make a decision as well. I just, on behalf of my clients, I appreciate that, because there was a period of time there where we weren't sure whether when Old Fort rolled to a scene, whether they were going to be able to use all the tools that are in their toolbox. And by the next morning, I understand that problem was resolved. I have since spoken with when I say spoken, I should say we have exchanged voicemail messages. The Vice President of North Central Ohio EMS, who responded to my voicemail and told me that they are absolutely ready to go with protocols for fire. So I am anticipating there will be no gap in the EMR protocols with Old Fort Volunteer Fire Department. What we may want to consider in the future as a commission is that if there's going to be some consistency in this county among the fire departments, I envision a situation now where you'll have Fire Department A that rolls up to the scene on mutual aid with Fire Department B and Fire Department C, and Fire Department A and C are able to do one thing that Fire Department B may not be able to do. And from a public perspective, that cannot occur. In my humble opinion, that cannot occur. The people of this county need to be comfortable in the thought that no matter who shows up, if they're wearing fire gear and they're properly trained, they're going to be able to do things that every other fire department guy or gal rolling up in fire gear is able to do. And that's probably a central issue with the commissioners and with the EMS, and maybe working in cooperation with the other medical directors. But I appreciated very much the time of Ken Majors. I appreciated the time of the Pleasant Township trustees. and of course, the men and women that work for Old Fort Volunteer Fire Department, and I know everybody appreciates the work they do. So for once, government worked quickly. It didn't require a big committee meeting, it didn't require a flurry of paperwork, and I'm happy about that. From the time that the problem was identified until the time the problem was solved, at least on a temporary basis, was very fast. And whoever was involved in that, I appreciate that, and I know my clients appreciate that, and appreciate your time this morning.
Well, let's talk directly about the letter, because I think there's culpability on a lot of people's parts on this thing. The fact is that the commission didn't see the letter until the day before it was to be sent. The letter should not have been viewed by anyone except for the trustees and the people involved prior to the registered letter going out. Absolutely no reason that it should have been sent out to anyone else. As it turned out, we had hoped to send it out on Monday or Friday prior to Memorial Day, but it didn't get sent out till Tuesday. By Tuesday, obviously, it was in other people's hands. So that's unfortunate. That's the imperfect storm, if you will, on that. So for that and any culpability that we have with that, we apologize, because that wasn't the way it's supposed to be. This commission didn't see that letter until at least Friday, as far as I can remember, and I didn't see it until Tuesday, but that's only because I wasn't here late Friday. So that was very unfortunate. Though, as you said, you don't want to be thrown under the bus by somebody that talks about a letter that you haven't even had a chance to review that. That's just not fair.
I kind of felt bad for the trustee. I didn't feel bad at the time, but I felt bad for him now. I'm just kidding, obviously. But I looked around the room, and I said today, I'm a fairly good poker player, and I could tell they had not seen that letter, and I felt bad about that, because I just assumed, because it was addressed to them. It was an undated letter too, and in my world, that's always a, you don't deal with undated letters. I would suggest, if you're looking for a suggestion, that you put on some sort of a rule that says if this ever happens again, everybody gets 90 days notice. Finding a medical director is not easy. There's high liability in that. Not everybody's qualified. You need to have special training as a doctor. You need Doctor Plus to be a medical director. Not any doctor can be a medical director. So if this ever happens again, and maybe as we go to ambulance districts or private ambulance services, the likelihood is this could happen again.
Well, and as you said, fortunately, the doctor was able to change his thought process by a phone call. So
Yeah.
we did get that handled the next day.
Thank you.
All right. Yes, David.
Dave Kingsborough, Pleasant Township. I think there's one piece of the puzzle missing, and that's Dr. Fitzpatrick. I've never heard from him. I've never talked to him. I'd like to know the timeline, how things worked out. What was the conversation leading up to signing the letter? I need to know those facts.
I think Ken was involved in that. So
Yeah, it was. That's, I'm not sure the exact date, but it was prior in the week of last week. I received a phone call from the fire chief, and he said, does this mean Dr. Fitzpatrick's protocols are not our protocols anymore? And I said, yes. He goes, don't you think you ought to send a letter, or he ought to send a letter to say that? And I went, let me give him a call and see what he wants to do. Because the previous letter, when it said Senate County EMS is gone, I felt that notified it. But the fire chief's like, no, it didn't. So I called Fitz and I said, they would like to have notification officially from you. So he goes, yeah, that's no problem. And he had some things going on, so I wrote up a real quick letter and emailed it to him. He added his pieces to it. I met with him Friday morning, the Friday that the letter was received here, and he gave me the letter. I'll take full responsibility for not putting a date on that letter, because I didn't know exactly when I was going to see him, so I didn't put the date on that. But no less than 3 people proofread that letter for me, and we still all 3 missed the date. So I'll take responsibility for that. I got that letter signed by Fitz on letterhead, because he just wrote it out on a piece of paper. So I typed it up quick, shot it back to him on good paper, brought it here to after he signed it at like 10 o'clock in the morning, and dropped it off here, 4 copies of it, so that it would all go out to everybody that it needed to go out to. And he said, yeah, that's fine. This letter says everything I want to say. And he goes, but he wanted to emphasize some points that he wrote in the letter. Yeah, I apologize for the oversight of the date, for sure, because that should never happen. I agree with you, Dean. And all my letters that I write usually have a date on them. He didn't put it on there because he didn't know when we were going to do the signature thing, and it was oversight on my part, and I apologize for that.
So how's come, if you knew about it, and you knew you had to put a letter together, how's come you didn't pick up the phone?
I did.
At least.
I did.
And you called the Pleasant Township House?
No, I
and left a
called,
message on our answering
I
machine?
called Fire Chief Malott.
Why would you call him when it's addressed to us?
Right, but it affects his people, and the protocols are operationally, that's where it needed to go. I kind of figured you guys would receive the letter a lot sooner than you did. So it was.
Did you do a
why I did
follow-up?
that.
Did you say, hey, did you receive the
I
letter?
didn't really need to, because all this blew up by the time that there
You
was any
didn't really
follow-up.
need to follow up with the trustees, make sure they got a copy of it.
I thought you did, and I apologize. I should have made sure that you had received that letter.
Well, we were hijacked, absolutely hijacked at Wednesday's meeting. And it was because of you that we were hijacked and your procedures. And I think that if your procedures are no better than what they were, then you ought to step down.
Right, well.
You
I'm
got
not
no
gonna-
business
not going
being
to
the
do that.
EMS director in this county.
Okay, I appreciate that, but I'm not gonna resign.
Well, you should,
Okay,
immediately.
sure. Understood.
And that's just the tip of the iceberg.
Continue.
Are there any other questions for Ken?
No.
Brett Cleveland, Adams Township. This letter was supposed to go out Tuesday. We still haven't received it. Our fire department still hasn't received it. They have not got any information from this. And as far as that letter goes, June 1st, they were out of service too. So why was it only sent to Old Fort Fire Department? And how did they get
They
it?
went out Tuesday, correct?
How did Old Fort Fire Department get this letter? Before the Pleasant Township trustees did.
Hang on. Who were the letters addressed to that went out from this office? Yeah, get that, please.
You want a copy of the letter?
I got the damn letter memorized.
It's
I don't know
obvious,
where they went.
it's obvious to me that there were a lot of errors on many people's part on this process, but the fact is only for a few hours was the townships without service.
Any of them signed?
We rectified the
No,
problem.
we haven't got 'em back.
got
We
with
haven't gotten
Dr.
the green
Fitz
slips back
very quickly,
From the mail.
reenacted, and everything was gone.
And they went out
And
Tuesday.
realizing
Tuesday.
that the Green Springs
A week
ambulance
ago Tuesday.
at best was only in service about 20% of the time. So the outlying
That made it
areas
worse.
have always covered it. Pardon?
That made it worse, because then we had nothing up there.
I'm sorry.
That made it worse, because now we had nothing. The fire
Yeah, that
departments
was-
couldn't
yeah,
do anything.
Yeah, I mean, it was a very dicey. I received a call Friday afternoon from Commissioner Kirschner, and I'm in Columbus, and, I mean, we understand the severity of this situation. I mean, as our position as commissioners is basically protection of the people, through the sheriff's department, fire department, and EMS ambulance. There's nothing I take more sacred, and as my fellow commissioners, and we understand the severity. I mean, I don't want to hash over the past. There was errors made on a lot of parts. Okay,
But-
fortunately, is a catastrophic situation didn't happen. And I agree with Consul Dean Henry that we need to make sure that we do something in the future so that we have a better protocol for this. I don't want to sit this whole meeting and hash about what happened.
The answer to the question at hand, on Tuesday, certified mail went out to Pleasant Township trustees at P.O. Box 71. Is it certified? Yeah, certified. Adams Township trustees at 7831 East Township Road 148,
That's my address, and I have not received anything.
Republic. Okay, I'm reading off of the receipts. 04 Fire Department, P.O. Box 70 in 04, and Green Springs City Council at 120 Catherine Street in Green Springs. Those are the four that were
Why
sent.
would they mail one to Old Fort when he hand-delivered it?
Actually, I emailed it after he called me and asked me if it was written, and at that time, I thought the letter was gone. So I went ahead and sent the email to Craig at his request.
So you think that you don't seem to follow up on much of anything, Ken?
Well, I followed up with Craig because he's the one who
Yeah,
requested that
the
letter.
guy we
from
got
me.
hijacked by, you followed up with him.
Ken, you said you gave the letter to Old Fort Fire when you talked to Chief Malat.
Right, he called me and I don't know, that might have been Wednesday. I don't exactly sure, not exactly sure when he called me, but he asked, he goes, does this mean this? And I said, yes. And he goes, well, you're probably gonna want to send notification of that, so that's when I talked to Dr. Fitzpatrick, so.
So
And
not-
soon after that, I sent it to
One of
Craig.
the- And did you, part of Brett's question was
I
reference
think I
to.
sent it to Craig like Monday. I'd have to look through my email, but I can do that, it's no problem.
One of Brett's questions was about Green Springs Fire getting notification. Did you make a call to?
I talked to Bill
Greens-
Anderson.
To somebody with
and,
Green Springs Fire.
At Green Springs Fire, and I asked him to let
Bill
that
Anderson knows
happen.
Green Springs
So,
Fire.
Bill Anderson's not Green Springs Fire.
Bill Anderson doesn't work for Green Springs Fire?
Greg Lowe's the
Greg
chief.
Lowe's the chief.
Right.
And then I'm sure you have Chief Horn's contact information that, you know, he's also with the fire that would be kind of a
Sure.
point to.
He is our first responder.
Yeah.
And you're the only one, right, Charlie?
We have three.
Okay.
Let me ask you guys a question. Do you feel at this point in time that you have adequate coverage for EMS in the places you represent?
So, let me give you an example. Just
Okay.
Friday, Mike,
EMR or EMS, Mike?
Pardon me?
You talking first responder or EMS?
I'm talking both. I'm talking,
Okay.
yeah.
through the way Ken promotes, just as in the paper this morning about how great the volunteer system is. I'm 2 miles into the township last Friday. Both my neighbors have fallen at the same time. So who responded? Sandusky County came and the city of Tiffin came. We're supposed to have county squads that are perfect because we have, you know, the volunteer system. The whole system is broke here in the county. Somebody needs to step up and start addressing it. And if you can't do it, you folks need to take and find somebody who will step up and get this system fixed. There's been many overlaps where there is not service, where Green Springs has been out, Bettsville's been out, Republic's been out, all at the same time. How long is Tiffin going to continue to come out into the county? Why should Sandusky County come into Seneca County to cover?
And we're not talking just over the line, we're talking several miles into
Into the
Seneca
line.
County. That Sandusky County is helping out to help bridge this problem until something is done.
Yes.
You can't blame this EMS problem on one person. I've lived in this county for 30 years, and we've had an EMS problem in this county all 30 years I've lived here. It's gotten worse in the last 10. I mean, you know, back in the day, you went and you took the course, you became an EMT, and life was good. Nowadays, the hours have increased, the continuing education has increased, volunteerism has dropped off. I mean, and everybody knows it. There isn't a person in this room that would argue with me about that. Finding volunteer firefighters. You know, every time I go to a fire scene, I notice these guys are getting older and older, okay, just like me. We all have gray hair now, and I don't go.
Or none.
Yeah, or no hair, right. This isn't one person's fault, and it's not one person's problem. And it takes a tremendous commitment even to be a basic EMT anymore. The days of even the fire school, you know, when I became a basic firefighter, it was 40 hours. Now it's 120. Who's got that time anymore? And so,
Well,
all due respect, you
Dean,
can't.
if I can make a statement, when we ask Ken Majors to come back and take this position, is one of the major charges that we've given him is to try to fix the system within the county. He didn't create it, it was to fix it. So by these joint ambulance districts, and by offering some sort of stipend for, which Hopewell has done, that's what we've tried to do. Now, is that a long-term fix? I don't know. May it get us through the next 10 years, improving on what's currently there. That's what our hope is, to try to do it at the least amount of cost to the taxpayers as possible. That was the charge that we've set Ken Majors out to do, and quite frankly, he's done it. He's done it. We now have many joint districts. We now have a slightly stipend volunteer system that works in Hopewell. Now, if it works in these other communities, that remains to be seen. But that was the hope, and that was the charge that we've given, number one charge we've given him
Well, it's-
is let's change this system, improve on it, because this full volunteer system will not work.
And it's a 10-year plan, and we have to let that plan work. It's working very well in 3 of the 4 districts that we formed, and we have to be patient to allow the other one to work. But within 10 years, we're gonna be doing a paid model.
But I think, Mr. Henry, the point that Dean made was, and I agree, is that, you know, the volunteer's age is now
Absolutely.
higher than it ever was before, and there's too much attrition and not enough filling in. Now, the problem with that is that if the model is that the county supplies the equipment, et cetera, and the township supply the volunteers, and one of those components has gone away, which is the volunteers, then maybe we need to change the model. Because when we talked about putting the model together, we talked about having an adequate number of volunteers, and we talked about being able to fund the equipment. So, you know, if one of those components in the equation are no longer what we thought they would be, then, you know, we've got to be a bit dynamic here and come up with another solution. And the solutions that, you know, try as we might, they're not working. I mean, when it gets to this level, ladies and gentlemen, something's not working. And here we are, you know, in the beginning of June in 2016, and we all know that everybody's working hard at it, and everybody wants to make sure that if anybody has a problem, they're covered, but we all know that the model is failing. So we need to come up, and our, you know, what we hoped is that Bascom would be the golden child, and they're having a difficult time at this point. So, you know, that was the model, and it worked, but it's starting to fail now too. So, you know, we just need to have some very serious discussions. What I proposed and what I asked, I know we've done this before, but I think that we really need to get serious about it, is to get at least one trustee from each of the townships to sit down and decide whether or not we need to, you know, more quickly move to a 4-station model or a paid volunteer or a paid model or whatever it is. I mean, I know there's questions about funding, but we have to have a plan in place before we can go to the state or before we can go to the Fed and say, can you help us? But if we do something that's a collaborative effort, maybe we've got some chance to get some funding, and maybe we got some chance for this thing to be successful. So, you know, what I would propose and what I would ask is that we get at least one trustee from each of the townships to really sit down and seriously talk about what a good solution to this is. If we can get people like the good people in Adams Township that'll approve a levy in many of the townships, we all know we're not going to put a levy on countywide, because the people of the city of Tiffin and Fostoria have coverage, they're going to turn it down. So we need to do it township by township, and we know that. And if we get a positive message out there for a levy in all the townships, rather than negative messages, maybe we can get them passed, and then maybe we can get it funded, and then maybe we can get a system that everybody feels comfortable with. So,
And Mike,
hopefully-
I echo
Yes.
Bill Franker at Adams Township. I echo exactly what you're saying. Here's the problem with that is you're gonna need a new EMS director to do this, because we've tried this, Mike, and Ken goes out and he demonizes anybody who is not looking at his system. You know, we've had a discussion before, it wasn't much after that, we had in the paper that Adam Greenslade and Bill Franker are against volunteers, and all he's doing is stirring up the little entities and stuff on that. So with this process moving forward, I'm telling you right now, you need a new EMS director who sees the vision, who knows that there's a problem there, and not grandstanding to say, our system's good, we have these volunteers here. I mean, again, collect the out of service data. I mean, Adam's done a heck of a job collecting all that information and seeing the overlaps and the gaps into this deal. He's talking a 10-year program. It needs to happen a heck of a lot sooner than that, I'm here to tell you.
All right, in all due respect, that'll be our situation to deal with, and
Yes.
what we have to understand is,
Well,
We recommend that you do.
We've been doing it for 2 years.
okay.
And it's disheartening
Can I-
to us as the township when we are doing everything we can do to gain the trust of our constituents, of getting them to pass this levy, when you have the EMS director putting things in the paper that has been put in. And then we have to answer that when there's no factual basis for what's being said. we don't see any way around it. Green Springs EMS is out of service the majority of the time. That's my parents, that's my kids. My son was life flighted last year. I drove him to the hospital to get life flighted because we don't have an EMS squad in our township. It's,
I've been in the
and the
same
county
situation.
is not helping us here, even with support. I mean, we're not asking for money, we're just supportive of what we're doing.
Well, what I was going to say is as, and I didn't finish, but as we move forward here, I respectfully understand the situations you've been in. I don't think any of us control what ends up in the paper. We obviously control what we say. Moving forward here, if we are to look at revising the plan, as Commissioner Kirschner was suggesting, and as I see some nods of, we know we have to look at something different. You as elected officials have to make the decisions, and I applaud you for making the decisions as we have to make decisions. So we're going to have to make sure we can live through what we have, because we can't change any of this overnight, as we couldn't have, when we had that meeting in April, 3 years ago now, we had ideas and thoughts. Now, coming right out of the gate, there's a lot of people who had really doubted that the compensated volunteer was ever gonna work. In some areas, different than other. Every community is a little different in our county. So it is working in some. For how long will that work? We don't know. Is it completely, Fred has said, it's not even been tested and tried long enough yet for some of them. Bascom's didn't work, took a long time, then it was working well. Now we're starting to see concerns there about them maintaining volunteers. So I get all of those things, and so we will have to move forward on looking at those things. But in the meantime, we're just gonna all have to put our best foot forward, improve our communications drastically, and then move towards. So if you can trust that we will look at what Commissioner Kirschner was suggesting, that we sit down and start looking at that, and then we'll have to deal with how and whom does those things in due time as well.
Well, and I would challenge you guys, if, I would like to get at least one representative from each of the townships together. And I'd ask for your help in that, because it's difficult to, it's kind of like herding cats sometimes. So if we can look at a couple of dates in the future, and I mean the near future, July, and set up a time to meet with as many, all three from each of the townships can come. I'm fine
Sooner
with
the
that,
better.
but,
Sooner the better.
yeah, okay. So I will call on you, hopefully, to help call some of your fellow township trustees and see if you can get them there. And I'm happy to do as much of the work as I can, but sometimes we need some nudges.
I will make this comment that shortly we're going to have a countywide trustee meeting.
Yes.
And one of you might want to be there and make that comment.
Okay.
And if you have a date by that
We will
time.
be there, yeah. We will.
We can present, or you could present
Right.
that to them also and get a little feeling about how many would come.
Yeah, it'd be nice if we could kind of test to see if a couple of
Yep.
dates work for a majority of
Yep,
people.
yep.
Yeah, we'll have it done by, what is that, June 24th or June 15th?
Third Thursday.
16th.
16.
And also, just a reminder, you've got 10 townships and 3 villages that already have voted to have EMS levies.
Yeah, I haven't agreed with you, Kim. We haven't even
I mean-
tried this
Yeah,
new
but-
system.
So, I mean, what I mean is, Mr. Kingsborough's right. I mean, we've got good support, and, you know, the way it goes, Mr. Kirschner's right. We've got support. We just need to either develop the plan or alter the plan that we approved in 2013 to move forward. Because the plan we approved in 2013 to move forward, we've done.
And how do we know that Tiffin and Fostoria wouldn't pass this if it, I said something
I
to
don't
Ms.
know.
Stacy about this before. If it's presented right, I think they will, because how many people work in Tiffin and work in Fostoria?
Yeah, well, that's-
There's a lot of people in Tiffin that work at Arm and Hammer.
That's why it's important to meet with the trustees. You know, if we think the best chance is to do it township by township, or if we think the best chance is to do it countywide. Look, I'm willing to look at either thing, but, you know, I just think we need to keep it open. There's been a lot of discussion about, you know, whether it would or wouldn't, and I don't know the answer.
Hey, Mike.
Yes.
Bill Frankfurt, Adams Township. Before we have our meeting, I would ask for you to contact other counties to see what kind of systems they have, how that's done, so we have some ideas to put out forth, because I trust you will get us the factual information on that. So call the surrounding counties, see what works for them, what they were doing, and.
If you need some contacts, let us know. Bill and I and Adam did quite a bit of information finding, and we've got contacts if you'd like to have some.
Okay, good.
Doug Stacy, Pleasant Township. Got two comments. One is, I think we are all in agreement that we were always covered by Seneca County EMS. Even the squad's going, everybody said, I've never heard anybody say you weren't covered. So why was the thing with 04 Fire ever canceled? They're still with Seneca County EMS. The contract was with Seneca County EMS. That's one thing doesn't set right with me. And the other thing that doesn't set right with me, I met with Ken the next morning. I was there when he came to work. And we talked for an hour and a half. And I asked him, I said, how come we didn't get a heads up? I'm really, some people I expect it from. Ken wasn't one of them, so he's lost my trust. And you know what his answer to me was? Well, I get no communications from the township out there, so I didn't see any reason to communicate with you. And I bit my tongue. It was all I could do to stay in my chair. Because he is a director and he works for all of Seneca County. We all pay taxes. Even if we have a private service out there, I think the director ought to be someone that we could call with any concerns or questions we have. That's just my thoughts.
Point taken. He is a county EMS director.
Just two short things. First of all, you may need a mediator on this one. No, I'm not kidding a minute. I'm not laughing when I say that. The world that I'm in, mediators work. You get people that are bumping heads, don't trust each other, you get them in a room with the mediator. And you might want to find somebody who knows a little bit about EMS and fire and county governance. And there are people out there that'll do that. And that might be something that, because you can't do this if you don't trust each other. It will not work if you don't trust each other. When you're talking about saving people's lives, y'all got to work together even if you don't like each other. The second thing that Mr. Stacy brought up, and it's a point well taken, Pleasant Township never had an EMS contract. At least no one's ever been able to show me one. And I think they agree they didn't have an EMS contract, and I don't think that process can go on. I think you have to have a contract. If Seneca County EMS is going to be your EMS provider, there needs to be something in writing that people can go back to, not necessarily to bind them, but to let them know what the rules are. For example, if your medical director is going to bail on you, he needs to give you 90 days notice. Would be a good provision to have in one of these contracts. Or if the terms are going to change in the contract, that the parties are able to sit down and negotiate those. Every single one of you up there has dealt with contracts in your career, and these are kind of standard terms. If the terms are going to change, you got to notify us. You got to notify us in a certain time. If you're going to leave the contract, if you're going to breach it, or you're going to quit, you got to let us know in a certain time. That's what a good contract does, and Pleasant Township didn't have a contract, which is unfortunate, I think. I think if there would have been a good one, everybody could have went back to that and said, hey, you were supposed to give us 90 days before you did this, so we got your letter, but we're not agreeing with your letter. We want you to abide by the terms of the agreement, stick with us for an additional, whatever it is, 85 days until we get a medical director, and then we wouldn't have to have a meeting, I think, or we wouldn't be here today. So it's just a thought. But I'm not kidding about the mediation. There's clearly some distrust here. There's clearly some miscommunication. And a good mediator can put people in a room, and it's not going to be a kumbaya meeting by any stretch of the imagination, but at least you guys will get to the point where you can agree to disagree, guys and ladies, excuse me, you can agree to disagree and then move on for the benefit of the public. And a mediator can truly help. I've seen cases where nobody was close to being on the same page, and at the end of the day, everybody's roughly on the same page. So I think
We have used that model in the past.
Pardon me?
We have used that model for
There
a
you
couple
go.
things.
There you go.
Great
Thank
idea.
you.
Good idea.
Yeah.
I have one other thing, Brett Cleveland with Adams Township. This JAWS that they pulled out of the Green Springs Fire Department, I still have a big time problem with that. That was paid for by the citizens of Seneca County. It don't matter if there's an EMS there or not, that fire department still has to have that JAWS to save people's lives. And they run in Seneca County. And then I talked to the fire chief after this meeting on Wednesday, and we was talking about it. They read in the News Messenger in Fremont that Ken quoted that they could have bought that JAWS. Nowhere was that ever discussed with Green Springs Fire Department that they could have bought that JAWS.
Where are those JAWS being used anywhere now?
Not currently. I wanted to wait for this whole thing to get resolved.
Really?
Do all the districts have JAWS?
Yes.
Wow, thanks for pulling away from us, Ken.
Madison has requested.
Thanks for thinking of the citizens of Adams Township and Pleasant
And you
Township.
wonder why there's a lack of
Yeah.
trust.
Well, Bascom has requested because they've got no set or because,
They need the extra set for their
Same
extra truck.
They use the same tools.
So Bascom has a set.
They do.
Yeah, they're about the same time ours was.
I mean, we was told through this whole thing that we was gonna be covered, and then
Then we got blindsided.
then we get blindsided. You know, we're trying to do what's right for our citizens, and then we've just been stonewalled through this whole thing. I mean, we did not feel we was gonna get the service that we was going forward with what we did. I mean, I've been a trustee for 12 years. I had Ken at our meeting when I first got on, because it was a concern. I looked at all the out-of-service times, he was there. He left. I had Don come in, he was the next one. He left. I didn't call Ken back in, because at that time, that's when we met in April and 13. Yeah, it just, this has been going on my whole time we was there, and it was going on before that.
Now, we need to have different discussions because we're not making any progress. We've been
I
talking
agree.
about this for a long time, I get it.
So we're
you
trying
know,
to make progress, and then.
No, I'm
it
not
falls.
saying nobody's not trying. What I'm saying is that we just haven't.
This meeting here.
You know, yeah. And so we just need to move forward, and, you know, I think Dean's idea is a great idea, but we need to, you know, we just need to move this forward in a different way than we have tried in the past.
I'd like to not put Bill Frankert, Adams Township, like to put Chief Horn. What do you need, Charlie? You know, because it's gonna be a little bit till we're actually signing contract tonight with North Central EMS. But it's good, they need to do some protocol stuff before they can physically put a squad there, the 24/7, 365-day coverage on that. So we're gonna have a lapse in there. Charlie's been great. I mean, he's been responding clear out to Adams Township, and I commend Charlie, and I think he's been in the Pleasant, you know, on calls and stuff. Where are we at, Charlie? What do you need to get us till North Central takes over? I know Ken pulled, you know, I'm assuming the oxygen, everything away from us. Where do we sit, Charlie? What do we need?
Well, currently we have nothing.
Currently, we have nothing.
So North Central did provide us with a couple of oxygen tanks, but I don't know that we're able to use those because I don't know what our status is for as far as EMS protocols for EMRs, because we've never received a letter from anyone or a response back saying we're back covered again. So Green Spring Fire Department's never received anything from anyone, whether we were covered or not covered. And so we have no knowledge either way. And so it'd be nice to know, somebody tell me Green Springs Fire Department's covered and Green Springs Police Department's covered, that'd be great, somebody can tell me that right now. You know, if we're not covered, then I guess there's not much we can help with, you know.
You're not covered.
So
Why is that?
there's-
Wait a minute.
Why is that?
You have a medical director, and that is covered, but we closed the station through the State Board of Pharmacy, so we can't store medications in that building. So the station's been closed through the State Board of EMS and through the State Board of Pharmacy, which I believe you can, in fact, I know you can, it's a simple phone call, and then you have to go through the terminal distributor license, class 3 for limited liability, which is oxygen.
How is Green Springs Fire different than Old Fort Fire? They don't have a squad there either.
They pay for their own medical license or their own pharmacy license, and they always have. But as Seneca County EMS, I just do the paperwork for them. So we do all of the compliance paperwork through the State Board of EMS, which is now, they call it the Emergency Fire EMS Transportation System, EMFTS, and also through the State Board of Pharmacy. So we maintain all the drug licenses for all the fire departments in the county, including Clinton and places that we don't serve.
One quick question. Has Greg talked to Don Bala from North Central?
I personally met with him last week.
Okay.
I think when Don gets their
So-
medical license going
Okay.
for their guys, that's gonna cover you, because it's an address thing, it's not a entity thing. Whoever covers that address is covered.
So I guess just to ask a question, so are we covered under Seneca County EMS protocols for
Yes, sir.
EMRs?
Yes, you are.
That's the question I have.
Yes.
Oxygen is a secondary thing, which is, I mean, we all know the value of oxygen when we're going to calls.
Right.
You know, but I mean, so I can still respond to a call in Seneca County and be covered. That's the
Yes.
question that we know, you know, all I ever received was a letter from, I assume from Chief Malat, that came to me directly to my email saying, hey, we're not covered any longer.
Right.
I've never received anything back from anyone saying we were covered.
Okay.
And the village has never received a letter either way, or Adams Township's never received a letter either way.
Okay.
You know what I mean? And so there's definitely some issues there with, as far as us knowing what we can do, you know, and so, as far as that goes, we're gonna do whatever we can, Bill, but we have no resources to assist other than what you have, is what, I guess what, you know.
I'll forward that same letter I sent to Craig.
Oh, we probably need to bring this to a conclusion, but, you know, let me hopefully end by saying this. as Commissioner Zoller said, we take the safety of the citizens extremely seriously. And we can't let personalities, and we can't let personal agendas interrupt the service that we have for the people that we represent. You know, this thing could have been handled, hopefully we learned from this. This thing could have been handled much better on a number of parts. Like I said, it's the imperfect storm. And, you know, we have to, above all, and I'm sure this commission agrees, make certain that the citizens are safe and that they're taken care of in the event of a problem. Whatever that takes, whatever that takes. So I will assure you that from the township standpoint, that whatever and if ever the situation comes up under my term, we will make certain that things are covered and covered well with no bickering until such time as a transition is made.
So going forward, so we as trustees can learn, you said there's numerous people involved, but how did we fail? Can you explain that?
That's right, that's, you know, we're all asking that question, hopefully we learn from that, but you're right. We all have some culpability here, to what level, you know, is the question, but we all need to make certain that we put everything aside but the safety and soundness of the citizens.
I respectfully disagree with you, Mike. We don't all have culpability here.
I would think
There's
so.
one man
I
in
would
this
think so.
room that has a ton of culpability, and we all know who he is. He's standing up right now. And I really hope you will take that into consideration when you want these trustees to come in and work with the EMS director. Without trust, you can't win anything. And you have to have trust, and that trust is so badly damaged, I don't know that it's repairable.
All right, does this conclude our EMS discussion for now? Respectfully appreciate you all coming in.
Thank you.
I know we weren't gonna totally resolve it here, but hopefully we've aired a lot and we have a plan. Commissioner Kirschner will head up to get a meeting set up.
Thanks.
Thanks for your time.
Thank you.
Thank you.
Good to see you. Dean, I'd be very happy if you could make some, maybe some recommendations for some mediators. I think that's a great suggestion. Try to find some people in the repertoire that you've dealt with before that may have some strength in this area, EMS, fire department, and we could reach out to them, get a cost. And I think that's an excellent suggestion. Thank you.
Have a nice day, thank you.
Pardon?
All right. Any further old business? Nothing else on the agenda?
That's enough.
Okay, again, we have a new business and we should be able to get that out of the way, or most of it out of the way before we have our bid opening.
We do not have any bill vouchers that seem to be on the agenda.
I think she probably sent them to my email. I just haven't, before I came in here, I didn't get them yet.
Okay. I have a supplement to the permitted appropriations for the Ohio Peace Officer Training Grant Fund, putting $2,682.06 into training. I have a supplement to the permitted appropriations for Public Assistance Fund, putting $10,000 into advertising and printing. Another one? Okay. I have a resolution rescinding the board's orders of May 31st, 2016, volume 92, page 253, authorizing the permanent appropriations for the capital projects fund. Let's see if she put in here why. And I guess that she needs to ask for an increase in budget commission before this was done. Resolution authorizing the Board of Seneca County Commissioners to sign the Ohio Department of Rehabilitation and Correction Subsidy Grant Agreement FY 2017. Resolution setting time, date, and place to receive sealed bids for the Fostoria ADA restroom upgrade project. It will be set for Tuesday, June 28th at 10:30 a.m. here at the Commissioner's office. A resolution authorizing Seneca County Board of Commissioners to enter into a food service agreement with North Central Ohio Education Service Center on behalf of the Seneca County Sheriff's Office. Actually, it's only an amendment. They're increasing the fees from $2.60 to $2.65. I have a resolution establishing the SFY 17 Community Corrections Fund. It will be Fund 1191. A resolution authorizing the purchase of the 2017 Ford Fusion for the Job and Family Services fleet. This is at the request of, obviously, Bob Anderson, Job and Family Services. They will be trading in a 2008 Dodge Avenger. I have a resolution authorizing the disposal of unneeded, obsolete, or unfit county-owned property. Again, this is for the 2008 Avenger that he will trade in for the other vehicle. And those are the only resolutions I have.
Do I have a motion?
Make a motion that we approve this resolution as stated.
Second.
I have a motion and a second to approve the resolutions as stated. Are there any questions, comments, concerns on anything? None? Roll call, please.
Commissioner Kirschner?
Yes.
Commissioner Moore?
Yes.
Commissioner Spacey?
Yes. All stand approved, thank you. All right. It is not 10:15 yet, so we cannot do the bid opening until that time. So at this point in time, is there anything else for the good of the order from the board? If not, we'll have citizens' comments. We were going to have a need for another executive session for personnel. Do you want to wait till after the bid opening on that?
Why don't we go into that now? If we can't get it done in 10 minutes, we can always,
We gotta be able to get that
I
done.
think we can.
All right, I'll make a motion.
So I'll move to executive session.
Seconded.
Motion and a second to go into executive session for the purposes of personnel. Call the roll, please.
Commissioner Kirschner?
Yes.
Commissioner Moore?
Yes.
Commissioner Spacey?
Yes, it's 10:11, and we'll move to executive session. Intent to be short.